I was recently asked for a quote behind the scenes, end quote, of what a therapist does in a day. The things that we as therapists do that our client doesn't see in the one-on-one session. So come with me for a behind the scenes for an intake session. Before ever scheduling the intake, I review the referral to ensure the patient and the presenting problem are within my scope of practice. As I work for a hospital system, I most often know my referring providers. Thus, after reviewing the referral, I often will try to contact them to talk more about the referral and ask any questions I may have. After confirming the referral is a good fit, I contact our front office staff to have them schedule the referral in my first available slot for a new patient appointment. A few days before the initial intake assessment, I will spend time doing a more thorough chart review. Since I work for a hospital system and all my referrals are internal, I consider myself very lucky that I have access to the patient's chart where I'm able to review records from multiple different specialists and get a more holistic picture of the client. I also make a paper chart for every single one of my patients, so before their first session, I will make a paper file where I put their name and date of birth on the chart. I keep this file for things like psychotherapy notes or anything we do in session on paper. I also gather all the consent forms that need to be filled out prior to the first session and store them in the paper file that I made for the client. Depending on the insurance, after the first session, I sometimes need to fill out a pre-authorization form so that insurance will pay for therapy sessions. This is highly dependent on the insurance, and I just have to fill out information such as diagnoses, why the person is seeking therapy, frequency of sessions, and length of sessions. After the intake session, I will type my note up. In this, I document what we talked about, the treatment plan. Since I have an EHR, this is where I also do diagnosis codes and billing. And the last thing I do is bring the consent forms to our front office to be scanned into the patient chart.